In this presentation, we'll be going over physical therapy guidelines before and after cytoreductive surgery. These are the learning objectives for the presentation. We'll be going over what CRS or cytoreductive surgery is and why physical therapy is important, where you might see physical therapy before or after surgery, instructions for care at home, incision care, and exercise and activity recommendations. What is cytoreductive surgery, or CRS? CRS is a type of surgery done to your stomach or abdominal area to remove all visible signs of cancer. This surgery can be combined with what's called hyperthermic intraperitoneal chemotherapy, or abbreviated as HIPEC, and it can also be done without HIPEC. Why should you do physical therapy? Oftentimes, your surgical team will refer you to physical therapy before and potentially after surgery. And what the research has shown is that doing PT before surgery or CRS will help you recover faster and help you return to your daily activities more quickly after surgery. In addition, doing PT after surgery can help build strength and increase your ability to move, which helps you get back to normal life more quickly. Even if you are physically fit before surgery, we still recommend you meet with PT to do baseline testing, and also because surgery is tiring on your body, the recovery can be quite a lot, so we can provide recommendations after surgery as well. There are a couple places where you might see physical therapy. The first is stage 1 before surgery. A physical therapist may check your overall movement and strength and may recommend certain exercises and activities. They may recommend follow-up PT appointments if they think it will be useful before surgery as well. This is often where we do baseline testing to get a sense of your physical functioning and general mobility before surgery so that we know where you'd like to return post-surgery. The second stage is after surgery, but while you're admitted to the hospital. The hospital stay can be on average anywhere from 7 to 10 days. And typically the day after your surgery, a physical therapist or occupational therapist should be coming to see you in the hospital and starting therapy as soon as possible after surgery to help you feel better faster. The physical therapist's role in the hospital is to help you with getting in and out of bed, moving to a chair, walking in the hospital, and taking stairs. Essentially, they're there to make sure you're safe to be discharged home. In addition, an occupational therapist can help with daily activities such as bathing, dressing, and using special medical equipment that you might need after surgery. The last place you might see physical therapy is after surgery when you're discharged to home. Your care team may recommend further PT after you get home, and this is to help you rebuild your strength, return to walking, help heal your scar, and also provide recommendations to help you get back to your activities of daily living. You can schedule PT appointments at Fred Hutchinson Cancer Center in our outpatient PT clinic or at a PT clinic closer to home. If you'd like to go to a PT clinic closer to home, you can ask your hospital physical therapist or your surgical team for a list of PT clinics. These are your mobility precautions after surgery. Your surgical team would like you to follow these instructions to help your incision heal faster. For 6 to 8 weeks after surgery, your surgical team advises to not lift anything heavier than 10 pounds, which is about a gallon of milk. Do not push or pull heavy objects. Do not do push-ups or pull-up exercises. Do not do sit-ups, strenuous exercises such as running, swimming, tennis, or playing sports where you may have contact with another person. If you become overly short of breath or tired, we ask that you slow down and take rests as needed. It's normal to have some discomfort, such as feeling stiff or sore at your incision site when you move or exercise, but we advise to stop doing any activity or exercise if there's pain at your incision site. Preventing falls after surgery is very important. We advise making sure there's good lighting in your home, removing items you may trip on, such as throw rugs, wearing closed-toed, closed-heel, non-slip footwear, and potentially installing grab bars as needed. This is a technique we recommend for getting in and out of bed after surgery. It's called the log roll technique. And what you'll do is, starting on your back, you'll roll from your back all the way onto your side. To sit up on the edge of the bed, you're going to do this by dropping your legs off the bed and at the same time using your arms to push up into a seated position, just as the photo shows. From there, you're going to stand from the bed with proper posture. We do have a handout called Back Health, Getting Back to Basics, for more information on proper posture. This slide goes over incision care. 6 weeks after surgery, gently massage your incision with lotion a few times a day. This is called scar massage, and it can help decrease pain and tightness at the incision site. We advise using unscented lotion that has aloe, vitamin E, or cocoa butter, and it's best to stay away from lotions that have alcohol, which may dry out your skin. We recommend paying attention to proper posture when sitting or standing in order to decrease tightness at your incision. Use sunscreens with SPF of 30 or more on your scar for at least 12 months. Make sure the sunscreen is PA/BA free and only apply sunscreen once your scar has fully healed, which is usually around 4 to 6 weeks after surgery. For more instructions on how to care for your incision after surgery, you can reference the CRS HIPEC handout. After your care team says it's okay to start exercising again, it's important to exercise regularly. Exercising regularly will help you return to daily and physical activities more quickly. If you have specific questions about specific exercises, please talk to your physical therapist or surgeon.